away a few steps, turn around and come back, whilst checking normal arm swing. Remember to compare both sides throughout the examination. First, ask the patient to push their hands against a wall with their elbows extended and look for winging of the scapula. Then sit the patient on a chair. Examine the joint from the front, sides, back, superior aspect, and the axillae for scars, swellings, asymmetry, deformity, erythema, sinus, and wasting. Ensuring that the patient is not in any pain, feel for temperature changes with the back of your hand. Then systematically feel the shoulder joint, associated bony prominences, and soft tissues. Feel for pain, maintaining eye contact with the patient, starting at the sternoclavicular joint, feeling along the line of the clavicle and around the acromioclavicular joint. Feel around the glenohumeral joint and scapula. Feel trapezius, deltoid and infraspinatus. Extend the shoulder, feel supraspinatus and then the bicipital groove. The biceps tendon may be felt in this position by internally and externally rotating the humerus. The head of the humerus may be felt via the axilla. Also assess for lymphadenopathy. This should be repeated on the contralateral side. Stand the patient and elicit the following movements: abduction and external rotation, adduction and internal rotation. Now test abduction, starting with the patient's arms by their sides, thumbs facing forwards and elbows fully extended. Ask the patient then to fully abduct their arms. Assess forward flexion with the patient's forearms fully pronated and elbows extended. Now test extension. Test adduction of the shoulder by asking the patient to touch their opposite shoulder with each hand. Now assess internal rotation and then external rotation with the patient's arms tucked into their sides and elbows flexed to 90 degrees. Muscle power is now tested against resistance. Test supraspinatus with the patient's forearm in full pronation. Test deltoid. Infraspinatus and teres minor with the patient's elbows tucked to their sides and flexed to 90 degrees. Now perform Gerber's test. Position the patient's hands behind their back with the dorsum of their hand touching the back and elbow flexed to 90 degrees. Ask the patient to lift the dorsum of their hand off their back against mild resistance. Sit the patient back down. Perform the apprehension relocation test. Externally rotate the shoulder until the patient feels pain or is apprehensive, then push the shoulder posteriorly, and this should relieve the symptoms for a positive relocation test. Now perform Neer's test. Internally rotate the patient's shoulder and pronate their forearm, keeping their arms tucked by their sides. Stabilize the scapula and passively forward flex the shoulder in a continuous movement. If pain is reproduced, this is a positive test for a rotator cuff impingement. To finish the examination, assess for multidirectional instability, lymphadenopathy, examine the joint above and below, examine and test the distal neurovascular status, ask whether the patient's symptoms affects their quality of life and sleep, help the patient dress,